Commissioner.
Good morning. You'll need to turn your microphone on. Okay. All right. Thank you for joining us today for this meeting of the Board of Lake County Commissioners. This is our second meeting on January 14th. Would all those who are willing and able please rise and join me in the Pledge of Allegiance to the flag of our country. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all. Grant us, O Lord, light to our understanding, prudence in our investigating, foresight in our planning, sincerity in our deliberating, the grace to follow truth in our judgment. Help us to be moved in our decision, neither by fear nor by self-interest, and to do our work faithfully. May we respect the authority vested in us, for thou art the source of all authority, and may we use in our directives for the common good and for thy honor and glory. Amen. Thank you. Madam Clerk, roll call, please.
Commissioner Young.
Here.
Commissioner Hammercheck.
Here. Okay, we have our first public comment portion. We will be administering the oaths of office to a couple of fine gentlemen here to our Soil and Water Conservation District. Gentlemen, if you'd please come forward. Dan, would you like to join us? Thank you. Yes, if you don't mind, yeah. Let me have that sheet and bring up a couple of these microphones here. Benefit of the audience. Yeah, John, if you want to. Sure. Dan, if you want to do your 3 minutes. Yeah,
Sure.
please.
I just want to point out that Mr. Thomas Rowan and Mr. Charles Dugan here were publicly elected to the Lake County Soil and Water Conservation District Board. These are 3-year publicly elected state of Ohio official positions, volunteer. So it's a very big commitment on their part. And we rely, at the Soil and Water District in the county here, we rely on their passion and commitment to the environment and good government to leverage local, state, and federal and private funding to address local Lake County conservation priorities. And we work very closely with all units of government in Lake County, all agricultural and residential commercial landowners. And it's with their guidance that the Soil and Water District does its business. So we really appreciate it, and we appreciate you administering the oath of office.
Excellent.
Thank you.
Thank you. Gentlemen, if you would take this oath together. Okay. Say aye, state your name in full, and repeat after me.
I, Thomas J. Rowan. I, Charles Dugan.
Do solemnly swear
Do solemnly swear.
Or
Do
affirm.
solemnly swear. Or affirm.
that I will,
That I will,
to the best of my ability,
to the best of my ability,
faithfully discharge the duties
faithfully discharge the duties
of supervision of
of supervision of
the Lake County Soil and Water Conservation District,
the Lake County Soil and Water Conservation District,
which I have been elected,
which I have been elected,
and preserve,
and preserve,
protect,
protect,
and defend the Constitution
and defend the Constitution
of Ohio
of Ohio
and of the United States of America.
and of the United States of America.
So help me God.
So help me God.
Well done, gentlemen. Thank you. Yay, there we go. Thank you, gentlemen. That is one of the true pleasures of this job. So thank you for the opportunity to give you the oath of office. Okay, and with that, under public comments, Administrator Jason Boyd, do we have any electronically submitted public comments? Thank you, sir, indicating none. Anyone in our audience who wishes to speak under the first public comment portion? No indication? Thank you. Okay, moving on to our resolutions. Madam Clerk.
In the engineer's office, resolution authorizing the county engineer to use the force account and make material purchases for maintenance, repairs, construction of Lake County roads, bridges, and culverts pursuant to Ohio Revised Code Section 5543.19 and to issue right-of-way permits pursuant to the Ohio Revised Code.
Move to adopt.
Second, and under discussion, Jim Gills. Oh, yes.
Well, I was going to ask the engineer a question, but I think he's going to answer it. Go right ahead.
Oh, you want me to answer it first? Or comment first? Okay, I can do that.
Ron, your microphone.
Basically, this is the resolution that we're required to pass every year, according to ORC. It authorizes us to do force account work and to buy materials to do our maintenance on the roads and bridges and ditches and whatever we do during the course of the coming year.
My question was simple, and I think you may have answered it by implication, but if you could tell us a little bit more about the term force account.
Okay. Force account simply means that we have permission through the state legislature to physically use our county employees to work on the maintenance and repair and other things under a certain amount of money. We do have a limitation that we can only do force account work up to the level of about $60,000 for per mile on our roads and $100,000 on the bridges. After that, we have to hire a contractor
Very
if the
good.
project's larger.
Very good. Thank you.
Yeah. The second thing I'd like to talk about with the President's El Presidente's permission is
Yes.
Madison Avenue.
Thank you, sir.
I'll bring you up to date on that. We have permission from the feds and the state to bid. It will be advertised tomorrow. We are receiving bids on February 5th, and we're going to turn those right around, and we hope to have a contractor on site by no later than March 1st, hopefully by the end of February.
Jim, thank you for that update. And ladies and gentlemen, the reason we could have slid that in under discussion, Engineer Gills will be yielding his seat to make room for our vaccine discussion later in our meeting. Jim, thank you so much for your help.
I have a question for Jim.
Oh, excuse me, Jim. Commissioner Young has a question.
Tell me about the Madison Avenue project again. What did you say about that?
Oh, we now have permission to bid from the feds and from ODOT. Because it has federal money in it, we have to go through a process and get their permission after we submit the final plans and specs for their review. So we're all good to go. You've already given me permission to advertise, and that advertisement will be appearing tomorrow in tomorrow's paper, and will be on the ODOT website, be on our website, and so we're ready to move forward.
When do you project that being done about?
By fall. The first thing that they're going to be doing during the initial inclement weather of March and early April will be working on the wall. We hope to be able to open that portion of the highway or the roadway, which has been closed for almost a year.
I've gotten a number of calls on that.
On a temporary basis, probably in May. And then right after that, then they'll go to work on the resurfacing. But also included in this particular project, along with the repair on the wall, is we're going to be replacing all of the catch basins. There are 109 catch basins, and some of the pipe that's not any good, while they're doing the wall and other things, so that by the time we reach June, it'll be ready to be paved. And it'll probably take about 3 weeks to pave it, maybe 4. So should be done by August, in time for the schools to open, that's for sure.
Very good. Thank you, sir.
Thank you. Okay, I believe we have no further discussion, so moving on to the vote on item number 1. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes, thank you.
In Job and Family Services Department, resolution approving Lake County Department of Job and Family Services vouchers, date of warrant January 22nd, 2021, in the amount of $607,773.43.
Move to adopt.
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes.
In the Finance Department, resolution approving payment of bills as listed on the Commissioner's Approval Journal in the amount of $1,923,899.25.
Move to adopt.
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes.
Resolution approving purchase orders as listed on the Commissioner's Purchase Order Approval Journal in the amount of $4,543,500.58.
Move to adopt.
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes.
Resolution increasing appropriations for various general and non-general fund accounts.
Move to adopt.
Second. Discussion? None being heard. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes. Okay, this brings us to our departmental reports portion of our meeting, and I will go to Jason Boyd, our county administrator. Indicating no report. Thank you, sir. And moving on to our commissioner clerk. Ma'am?
Yes, I just wanted to mention that county offices will be closed on Monday, January 18th in observance of Martin Luther King Jr. Day. And also, I wanted to mention that there will be 3 terms expiring on the Visitors Bureau Board of Trustees. They expire February 21st, 2021. So I just want to throw that out there
Very
as well.
good. Oh, boy.
And also, the next commissioners' meeting is going to be next Thursday, January 21st at 10 a.m.
Very good. Have we received requests for reappointment?
Not yet. I will be asking for those today.
Very good. Thank you, ma'am. And moving on to legal. Legal.
No reports, Commissioner.
Thank you, sir. Okay, this concludes our departmental reports. Do we have any old business to come before this board? Do we have any new business? Jason, I'm going to kind of flip a coin here of, do you want to introduce stuff under new business, or do you want to do it under second public comment?
I do have a public comment.
Very good. Okay, then if we have no new business, I'll move on to second public comment. Administrator Boyd indicates we have a submittal received by email. So Jason, if you would, please.
Yes, good morning, Commissioners. We have a public comment, and I do apologize to Ellen Chamberlain, who you know.
Yes.
She submitted a comment last week, I believe, for the 10 o'clock, and I think we may have addressed it in the 2 o'clock meeting. But nonetheless, I want to re-enter her comment into the record this morning's meeting. This was received earlier. I submitted a question last meeting, but there was no public comment section during the organizational meeting, although public decisions were made. I asked that the Commissioners respond to former Director of Health Department Joe Lucia's News Herald letter of January 2. He asked about public testing locations and public sharing of plans for reducing the spread and immunizations. It is no longer satisfactory to continue to say we are doing everything we can. Respectfully submitted, Ellen Chamberlain. End of comment.
Thank you, Jason.
And upon completion of this, I would like to introduce some guests for you, Commissioner Hammercheck, to discuss this very topic today. Thank you.
Indeed. And to Ms. Chamberlain, I will abbreviate my responses out of respect for time and knowing what our next presentation is going to encompass. Former Director of the Health District, Joel Lucia, which conspicuously was not put into his submittal, made a number of what I would call patently false statements, one of the biggest being the composition and organizational structure of the Emergency Management Agency. I have personally spoken to Joel. I have challenged him on his assertions. What he referred to in his editorial was the structure of a peri-nuclear power plant drill. That is not the organizational structure. That is not the command structure. That is not the operational structure of the Emergency Management Agency. His assertions regarding the health district, well, I will let the next presentation take care of that. But I just wanted to make sure that it is abundantly clear that the Emergency Management Agency is a department under the control of the Lake County Commissioners, and our director happens to be with us here today. And if I may, I hope that satisfactorily answers the email submittal, but more fully and completely being addressed, we are going to be doing a presentation regarding the vaccine plan. One of the things that our Governor DeWine has asked is that each county, working with the health district and emergency management agency, and in this case we're going to be working closely with the Board of Commissioners and the mayors and managers. We have a plan that we would like to address and roll out. If I may, I would like to actually begin with Ron Graham, Lake County General Health District Commissioner. Ron, would you mind, or Jason, did you want to tell you what? I'm going to throw it to Jason because I just got the high sign there. We're going to make a little pre-event discussion. So
Yeah, thank you, Commissioners.
Step away from the microphone here.
That concludes the electric public comments that we received today. So as these gentlemen are approaching the commissioners' desks, as we know in this room, and as some of our residents may know, the governor made an announcement, I believe about a week ago, about the Phase 1B vaccination strategy, and at his request asked that counties issue a press release or press conference of some nature on the localized planning effort. And we thought it would be prudent to use this beautiful facility, our YouTube live channel that we will today share with all of our communities, and have a discussion and just a very brief presentation with the facts that we know it today, with the folks in the room. And I guess I can't stress enough the importance of the work that these three gentlemen, amongst dozens and dozens of others, have done. So with that being said, Commissioner, I would hand it over to you for brief introductions to these gentlemen, and we can discuss the county-wide cooperative multidisciplinary plan that's been worked on for hours on end. Thank you.
Well said, Jason. Well said. Thank you. As I'd indicated earlier, we have with us Lake County General Health District Commissioner Ron Graham. Ron, you're sitting here to my right. We have with us our EMA Director Joe Busher to my left, and we also have Mayor Dennis Morley here representing the Mayors and Managers Association as their president. And if we could kick this off, Ron Graham, would you like to start, sir?
Yeah, thank you, Commissioners. Appreciate the opportunity.
Extra mic discipline because the audience has such a terrible time hearing us, so thank you.
Yeah, thank you, Commissioners. Ron Graham with the Lake County General Health District. Been employed by the Health District since 2007. I've been Health Commissioner starting 2015 to present. Not only am I Health Commissioner, I'm a father, I'm a husband, and I would protect this community as we would my own family. Dedicated staff, dedicated community partners in Lake County has been wonderful. A lot of misinformation. The one thing I'd like to cover is that when it's a lot of conflicting information coming out from national channels, state channels, local channels, once information gets out, you cannot pull it back. So we've been strategic in our communication to the public. We have spoke with your commissioners, the administration, fire, EMA. There's not a partner I don't touch almost every day with some conversation. And I think my colleagues will address that point. What I want to convey today is that we have multiple scalable plans to address this pandemic. The only thing that will make us not successful is lack of vaccine, which is what we're looking at is very scarcity. It's the scarcity of vaccine. It's a new vaccine, so there's a lot of concern out there from the public. We developed a partnership with Lake Health, the county commissioners, EMA, fire departments to scale that up. One thing I need everybody to understand is as this vaccine comes in, it's going to take weeks and months to distribute based on the vaccine that we have available. Currently, we only received 400 doses between Lake Health Hospital and ourselves that'll be issued out next week at a clinic. We took extreme efforts to create a system of registration, enrollment, notification with our new 911 system, which will be discussed, and also scheduling in partnership with Lake Health. There's not a partner we have left out in planning that we're aware of, and we have, again, those plans will be separate modalities. Some may be a closed clinic, which would be more of a facility that's indoors, socially distanced to give that vaccination, monitoring for any side effects, which at this point we have very little to no side effects reported of any significance to CDC, to ODH regarding our vaccine. Mostly just a sore arm is what could be expected from that vaccine. However, everybody's different. All this information has really been coalesced into what we think is a good plan to move ahead. The governor has designated January 18th for Ohioans 80 years of age next week 75. Within 24 hours of our first posting the enrollment system through Lake County Health District and Motivate Lake County, we received 8,000 enrollments into that system. Within 48 hours, we had 15,000 people registered for that system and 400 doses of vaccine scheduled for next week. You will see other providers, Giant Eagle, Mark's, Discount Drugstore, helping us in the submission as well. So in this public health system, we are a health department, but we are also a system, and it creates a network that it needs to be communicated to everybody consistently. And that is what you're seeing is all our planning that we've been doing over the summer to protect our residents, to protect our businesses, to protect our schools. Is finally to the point where we can have some actionable items with the vaccine. The vaccine is safe. We need people to understand that. We're not going to mandate that you be vaccinated, but for those that want it, we're going to move it as fast as we can here in Lake County. In doing that with a scalable partnership, we feel that we can do that, running clinic up to 5 times a week if we need to. Again, it's all subject to the vaccine, which is going to be calculated by how fast we can move it. If we move it less than 80%, in 7 days, there's some penalties of the vaccine not coming in. So we cannot fail. It's not an option for us. Anything else you want to, guys? Did I miss anything? Again,
No,
we need to continue social distancing, the mask wearing. We need to do that to get our kids back to school, our families and residents back to work, and create the healthiest community we can.
Very good.
I have a question.
Yeah, sir.
Yes, sir.
Thank you. Ron, you mentioned your plans to protect residents, schools, and businesses.
Mm-hmm.
I've been very supportive of your plans, and I believe they're well thought out and effective. Could you expand just a bit on the business portion of that? As you know, I believe that a good, healthy business community leads to a good, healthy county in many ways. Spousal abuse goes down when people are working. Child abuse goes down when they're working. Drugs, the use of illicit drugs is reduced when people are working. They have a hope for the future when they have a job. Very important. And what have you done in reference to that specific component of the 3 different areas that you're hitting there?
Okay, so what we try to do for schools, education and income are 2 of the most aggressive indicators for health. They really help support that. So we took as minimal approach as we could and some local control on making decisions like keeping certain businesses open, despite the governor wanting them closed. We relied on contact tracing and looked at the disease, not just the mandates across the state. So we really tailored every operation that we made collectively with the commissioners and ourselves. Certainly I am in charge with the Board of Health, but Minute Rocks was one of the items we kept open for just peace of mind for individuals. It was a safe event. We're trying to keep our schools open so that parents can go to work. And we worked with our businesses to convert over from like restaurants to take out and pick up meal delivery, things that they were normally scheduled to do. So we tried to really provide any resource we could to keep those businesses functioning, minimizing quarantine and isolation orders to bare minimum.
Very good. Thank you.
Thank you, sir.
Very good. Moving on to our EMA Director, Joe Busher.
Thank you, Commissioner. As you know, since the beginning of the pandemic, under your direction, the Lake County Emergency Management Agency has been working closely with the Lake County General Health District and all county partners under a unified command. The EMA has implemented established plans, managed PPE, and assisted in all the needs of Lake County General Health District. We continue to work to assist in the points of distribution, known as PODs, as supplies become available to vaccinate the citizens of Lake County under a phased system as quickly and efficiently as possible, recognizing the biggest hurdle to this process is going to be the quantity of vaccinations received weekly. And I'll be happy to answer any questions, sir.
I would ask, and because the public hears pods. You briefly comment on it. Could you give a little bit more in-depth explanation? Because people hear that and they're a bit confused as to exactly what that means.
Well, as you've been seeing on TV, there's many different ways you can establish pods. Working with the Lake County Health District, we made recommendation to hire a planner, which they have done. It's a retired fire chief who had worked under the H1N1 planning process some 10 years ago. He's working with assigned people from the health district, and in conjunction with our fire chiefs, a group of them. They are basically developing a plan that can be adaptable and to many different locations depending on the quantity of vaccinations received. We have a plan for next week that Commissioner Graham went over. We have established a way to notify the public using the reverse 911 system that you purchased at the end of last year and was put into place, operation on January 1st. There is going to be a keyword that you will find in the press release today that you can text to a particular number to get updated vaccine information as that information is being put out by the health district. It will give you the ability to go sign up as we send out group text to individuals as the age group following the phased approach, and the ability to send out to groups to not over populate those times, and to have people come and have the process run as smooth as possible. The fire chiefs have, as I said, they went from everything from a small pod to what they call a super pod, and you've been seeing those probably on the news. Good example would be a parking lot in I think it was the California area, where they're doing multiple. We're not at that phase with the vaccinations that we're getting in, but I can tell you in review of the plan, in discussion with all the individuals been working on, they have plans, and I believe the plans will work. In fact, I'm 100% positive of it.
Thank you for that expanded answer. Some of the thoughts, this directly addresses scalability. So although we have limited vaccines available right now, there are limited vaccines in the pipeline. We have a system in place that can respond to the needs of our community and the logistical supply of vaccines coming in as it increases.
Yes, sir.
And now this is, again, a bit of a hot topic, waste. We have taken numerous precautions at all levels so that no vaccine will be deliberately wasted because of bureaucratic restrictions. Now, obviously, there could be something dropped or accidentally contaminated. There's going to be loss because of accident. That's anticipated, that's part of the system, but we're being very respectful that waste is going to be kept to the absolute minimum, if not fully mitigated. Is that reasonable?
Yes, that is reasonable, and under the phase 1A, when they were getting the vaccination, I can tell you that I've been told that no vaccines were wasted during any of that process. So it was smooth. If they had extra, they were able to reach out quickly and get others to come in to get the shots and not waste any doses within our county.
And this is, if I may just finish the thought, and Commissioner Graham, I may ask your comment as well. The reason that it's so important that we have a rapid response capability as far as not waste. Some of these decisions could come down to minutes, at the most hours. So that's why it's so important to have a flexible, scalable system. Did either of you or both of you want to comment on the...
Yeah, no, I'd be happy to. Just to describe, a pod is really just points of dispensing. So we scale those. We did those with H1N1. We had very large mass vaccination clinics, as we would call those. And that's really not an option for us during this event because of the social distancing. So we developed east, west, and central locations to minimize travel for our community. We're working with Lake Trans for transportation. And as far as the doses, we're actually getting sometimes 11 doses out of the vial versus 10. So if you look at our tracking record, we've actually dispensed more vaccine than received because of the 11th dose. in each community we're in.
And before we move off of that, it's because of the typical overfill.
Yes, correct.
It's abundance of caution by the pharmaceutical companies to make sure that there's guaranteed enough product per
Correct.
vial. Just want to be clear to the audience that nobody's getting a watered-down version.
Watering it down. And so then we also we'll be doing schools as closed pod format. We'll be doing drive-through clinics for those people, individuals that feel more comfortable that way. So it's certainly scalable to all the vaccinations we try to give at the beginning were 1A, and also anyone that could vaccinate. It could help physically work with us to inject an arm as what we need to keep that infrastructure in place.
Excellent, excellent. Commissioner Young, I believe you had something you wanted to add, sir?
Well, I just, either Joe or Ron, how many vaccinations have we received here in Lake County so far?
About 1,700 this week,
1,700.
and we've given out all but 60 doses now, and the last 70 will be used by the end of the week.
So we've actually administered more doses than we were officially sent, if you will.
Yes, because the overfill, and the majority of the vials are overfilled at this time for the manufacturer. Now the pharmacies will receive about 2,000 doses next week, when we're receiving 100 from the health department and then 300 from Lake Health.
Okay, so 2,400 then in total?
Yeah.
Okay. And how many doses have we handed out, or have we?
We only have 60 there already accounted for the rest of this week.
Okay. So we received about estimated, say it again, I'm sorry.
We had 1,700 today. We'll be receiving 100 next week. Combining that with Lake Health will be 300. The other ones that received vaccine were the hospitals for the healthcare workers, and then Lake Health is working through that right now.
Okay, very good. How is all this being announced?
Today is really
radio.
Yes, it'll be all modes with the reverse 911, the press releases to all communities, partners, websites, radio, anything we can do to get the message out once this begins to roll. The important thing to know is we want to do this by appointment and avoid long lines like you're seeing in Florida. And if you come to if you're scheduled, you register, you're scheduled, you will get the vaccine as long as we have the supply.
And where have we had our, I guess, just for the sake of the folks who are just tuning in or whatever, define what a pod is and where we've had our pods to date.
Primarily our pods to date for us at the Health District have been our building located on Blackbrook Road, and because it's a drive-through, and so we've been doing about 250 in a day at that facility, training EMT staff to help work with us, our Medical Reserve Corps volunteers and our staff, and probably the next one will be somewhere with the Lake Health system, announced later here for next week.
And people are screened at that point at the pod then, I take it?
Yes. Yeah, now that we're moving off 1A, we'll be getting driver's licenses and IDs to help control compliance, to make sure we're screening for that as well.
Okay, how many different pods have we set up at this point?
It's almost countless. It's just really based on what we can get as vaccine. We can do them
This-
5 days a week, or
If I could just jump in, the difference between being set up and deployed, I think, is the real
Yeah, I was wondering
point of discussion.
how many pods have been deployed to date?
3 at our location, and the rest have been closed clinics looking at nursing homes or assisted living, and those that are mentally and physically disabled.
Where were the
residential
3
congregate
at?
homes. We did them all at Blackbrook Road.
Okay.
Yeah.
Very
And-
good.
And Administrator Boyd, I believe
Yeah.
you have something to add, sir?
Yeah, to Commissioner Young's questions, which are warranted, I think it's important to note that Phase 1A that Ron is referencing in those pods on Blackbrook Road dealt with, as the governor has mandated, those first responders and those individuals. So that's been the primary activity with the doses received to date under the health district's control, and working with our great partners at Lake Health. They've in turn had their own internal doses where they're taking care of their folks. And to Mr. Busher's point, or Commissioner Hammercheck's, the word scalable is key, because depending on the dose amount we receive, we'll be able to use the Fire Chiefs Association and Chief Powers and Chief Searles and so on to scale up based on that demand. And I can't stress enough what Health Commissioner Graham has noted. We have a pre-registration portal that the Health District has activated. the website. It'll be on the press release that is going out as we speak, that folks can pre-register. I think, Ron, you said 15,000 folks are already in there. We'll utilize our reverse 911 technology, and additional data will be forthcoming. And then ultimately, and probably most importantly, as Ron has said, scheduling is critical to this. We have to, and I can't stress enough to our residents, there's 2.2 million folks in Ohio in this phase of the senior demographic. As we know all too well in Lake County, senior centers, we have a third of our residents are seniors. We have 400 doses for 60 to 70,000 seniors. We are going to do the best we can collectively to get those out in the most expeditious manner. But the scheduling component via online, we'll have phone banks set up with additional details forthcoming, is extremely important. And the work that these guys have done to date will help us get there. So scalable is extremely important. Phase 1A, I believe the numbers I saw, Ron, you were at 90-some% on vaccination. I heard great things on the pod on Blackbrook Road. But phase 1B is just a whole nother level of planning, talking about the quantity, the communication styles, be it web versus phone. With this senior demographic, we're trying to address all of those variables. I just wanted to kind of tie up some of the points that were said.
Very good, well done.
Thank you.
So phase 2 will be seniors.
Yeah, it's called Phase 1B populations, I believe, Ron, is this
Correct.
governor.
Yeah,
And it's on the screen, and if Mr. Sable could zoom in for our folks at home, we've got, week 1 is next week, depending on when the health district and the other providers get the dose. Are those 80 and older? The second week, which is the week of the 25th-ish, is those 75 and older and with cognitive or developmental orders, and it goes down the line. All of this is on the health district's website, which we would continue to drive traffic to. There's a COVID link right there. There's a COVID link to the pre-registration, and all that information is updated on a daily basis. But right now, the important part is we wish we had more. We're getting what we get, and we're going to schedule prudently and effectively based on the directives of Governor DeWine, and get these things out as fast as we can. So, thank you.
So the
Thank you for
pods will be
clarification.
at senior centers around the county then. Will that
As
be the
needed,
key
we have that. We
for
have
the
plans.
second phase?
We have plans for all those. We'll light them up depending on the vaccine we receive, weather conditions, many variables that we'll look at. But we could identify the pre-established locations we've worked with and have plans for.
Very good, thank you.
And I believe it's appropriate to echo and amplify the supply chain discussion. Again, we have to manage expectations of the public. Registration does not equal automatic vaccination. Again, just to keep things in perspective, our first round of supplies was 500, followed by 400, followed by 400, followed by 400. We have 234,000 people in Lake County. I need to be abundantly clear on this. We do not control the supply chain. What we are discussing here is the disbursement of the supplies that come to us. We are better positioned than most counties. There are some considerations in place at counties such as ours that are better positioned. On that waste issue, we will get supplies in advance of a county that is not capable of dispensing. Ron, did you want to make mention of that, sir?
Yeah, so we think we'll get a leg up. We're willing to accept Pfizer vaccine, which is the sub-zero kind of freezer stored vaccine, which many counties cannot handle. We do have the equipment to handle that vaccine. That will give us a competitive edge. Our ability to move this vaccine within 7 days of receipt or less will allow us to get additional doses for those counties that cannot keep up. And that's really where we think we're going to move ahead, is being able to do the variety of vaccine we can accept and willing to accept, and the scalable where we can have individuals vaccinating on our behalf.
Excellent. And I'm going to give a big background setup here for Mayor Morley, representing mayors and managers. We heard our Ema Director refer to unified command. Very early on in this discussion, when we looked at facing a pandemic, Mayor Morley very quickly became our go-to guy for civilian leadership. I reached out to him and said, we have a problem. Here are the identified problems right now, and we're looking to what else is out there, the unknown unknowns. I will tell you firsthand, Mayor Morley took up that challenge. We worked very closely with Ron Graham, our Health District Commissioner, Joe Busher, our EMA Director. I have to tell you, Mayor Morley, worked hand in glove with me. I don't think I'm exaggerating saying that our friendship and our personal working relationship has gone up exponentially over the last several months. It is an honor and a pleasure working with you, sir. I have to say that you worked very closely with me establishing a network for civilian leadership. The communications are a model here in the state. Your efforts and work directly with establishing communications with our police, fire, EMS, and our senior centers was exemplary. I have to say that we very quickly established lines of communications with state and federal agencies and the assets under their control. All of this was over and above the pre-existing systems that were in place, which is, again, why Lake County has not only adopted best practices where appropriate, we have created best practices. And with that big setup, Mayor, I'm going to turn the microphone over to you, sir. So there you go.
Thank you, Commissioner. You know, I deeply appreciate all of what you said.
You've
about
earned it, sir.
myself
You've
and,
earned it.
all of us that work together. I'm here, one, to thank you as Commissioner, as President of the Lake County Commissioners, Commissioner Young, Director Ron Graham, Ema Director Joe Busher, Jason Boyd, Lake County Administrator, that also we all coordinate all our COVID meetings with. On the line, on Lake Health, Cleveland Clinic, all our cities, villages, townships, along with our fire chiefs and our law enforcement. Back in March of 2020, when this pandemic did start, Commissioner Hamercheck and I did discuss, and then we actually got a hold of Joe Busher and Ron Graham, and we put our committee together. Back in March, we started at 2 calls a week with all the mayors and managers, our trustees, people from the hospitals, Lake Health, Dino DeSanto, Dr. Dews from the Cleveland Clinic that's on our calls every week. So we started out last March at 2 calls per week, 9 a.m. every Tuesday from here till this pandemic ends. We did reduce it to 1 call a week once it got started and we were into it a little, had a lot more information. We actually did have, I contacted Governor DeWine at one point. We did have him on one of our calls with the mayors and managers. The EMA has also set up a system for all of us at mayors and managers in case there's some sort of emergency that we are all, get the reverse 911. There'll be, if there's a special email that needs for us to all read, we are prepared for that. Last night, and regardless of any time during the day that we had, last night obviously we discussed, myself, Joe, Commissioner Young, or I'm sorry, Commissioner Hamercheck.
We're twins.
And yeah, you look alike some days. And then Jason Boyd. So we all spoke last night. My last conversation with the commissioner last night was at about 9:30 on his way home from where he was at. So we have set up emails that go out daily from my office to all the village townships. I mean,
That's where you say thank you, Judy.
Yeah, there is no shortage of emails that go out there, and once Ron gets us the information, or Joe sends us the information, it's out. We sent out to all our mayors and managers last night what's going to be rolled out here today for the press conference today. Fire chiefs, the health district, EMA, and the county are working on the pods, which are the points of distribution for those that don't know what the pod acronym means. When and if more vaccines come available. This county is and will be ready for our residents during this pandemic. We all will continue to work together as one team for our county, and we have done this since last March and will continue. And again, as Commissioner Hamercheck said, it has brought all of our relationships to a point that was never, ever that I've seen in this county working together. And unfortunately, this pandemic has brought us all together. But again, I believe after the pandemic and after we can do some things for our residents and go back to our normal lives, that a lot of things will change. As Commissioner Young brought up, we have on our meetings, we do discuss our businesses, we do discuss our senior centers, we do discuss the things when this is open and there's more pandemics. I mean, we're already discussing, hey, what possibilities can we have in the summer for, as I said, Men of Rocks, or we're hoping that our Lake County captains can play baseball again this summer. once, the parameters are set. But I cannot emphasize anymore how this county has stepped up, and we are doing everything we can. Again, the vaccines rolling in, as they said, over the weekend, 12,000 sign up for 400 vaccines. We need to get more vaccines. We need to get things moving, and we're all going to work together to continue to get that. So I thank you, and again, I thank you for the compliments. I think we all need to compliment each other because we all have been in this working together, and we will continue to do that until this is over. Thank you.
Thank you, sir. But I also think, and I made a little quip there about thank you, Judy, but Judy Moran, I think it's appropriate, though, that we also recognize the importance and the value of the staffs that we enjoy at all levels. The professionalism, the dedication to service, it's amazing. We've been doing in-person, split shifts, virtual, at all levels of county, city, village, township government. It's amazing. I at the risk of being a little folksy here, I haven't seen a clunker yet. We've got some rock stars out there, and the public needs to know that. And that's why I say, continue to get us your public comments, express your concerns. The civilian leadership is essential. The information, as it becomes available, we're processing it, we're acting on it, and we're trying to get that information out to the public for the public good. Much of that, though, comes because of our support staff. We can do the most exceptional job imaginable, but without our support staff, it's not there, which goes to EMA Director Joe Busher's point of the effectiveness, the expandability of these. Again, I'm going to call it points of dispensing, pods. Just keep emphasizing because you hear these terms of art and people get a bit concerned or confused by what that means. If it wasn't for the staff, the people that are actually doing the hands-on work, we would not be as effective or as efficient as we are. And I have to emphasize the critical nature of being flexible. So again, keep your questions coming. We will even address, and I find former Health Commissioner Lucia's editorial to be misleading and in some regards downright deceptive. But this is an opportunity to clear the air on that, now and forever. I hope you're seeing the level of thoughtfulness and planning, but we have to react to what the federal government dictates. We have to operate by how the state dictates and or mandates, and our local control, as our Health Commissioner Graham expressed, is limited, but I will tell you now and for the record, it has been my observation that our Lake County General Health District has made full use of local control, being more restrictive when and where necessary and less restrictive when and where necessary. Again, scalable. Candidly, it's impressive, and I appreciate the public taking note of this and giving us the opportunity to address their concerns. And let's see, and with that, I think it's worth echoing and amplifying. There has been waste in our country. An example that's definitely unfortunate, New York. New York has wasted through destruction and disposal more vaccine doses than have been issued to the state of Ohio in total. ×2, I believe. It's reprehensible. But I want to say now and for the record, this group you see assembled here, along with the support behind them, will never allow that to happen. And to those who are asking about Lake County getting more doses, I want to reemphasize, by being as professional and as effective and as ready as we are, we will be receiving anything that others are not able to effectively use. Again, avoiding waste. So is there anything else anybody wants to add? Jason,
I just have one question.
Commissioner Young, please, sir.
Commissioner Graham, in reference to something you mentioned, Commissioner Hammercheck. We talk about New York wasting. Can you share with us for just a minute how they've wasted so many doses as a sort of a warning to us here in Lake County, if you will? Not that we're about to waste dosages, but what have they done there? How could they waste so much?
Your microphone, sir.
Waste is often created by mishandling and storing of the vaccines. Temperature controls, responsive systems that monitor the temperature, drawing it up inappropriately, not scheduling the clinics appropriately. There's multiple reasons it can happen, including dropping it on the ground, which we do not want to happen. But primarily, it's just easy mistakes when you don't have controls and training in place.
And I'll take it one step further. I can say what Commissioner Graham can't say. The political bureaucracy that they're having to endure there. We are fortunate. Love our governor or hate our governor, he has not tied, and this goes back to local control, he has not tied our hands by mandating that this dose has to go to these specific people. The flexibility that gives us under, again, local control. Again, love Governor DeWine or hate Governor DeWine, he has not tied our hands, giving us the maximum ability to not waste. So I think, Commissioner Young, that goes directly to your point. And Commissioner Graham, I thought I would give you a little cover on that one politically.
Yeah,
so,
okay, yeah, so thank you.
Thank you, sir.
You've always loved me at the state. But.
Hey, again, where best practices don't exist, I'm proud to say Lake County is creating them. So, Administrator Boyd, I believe you have something you'd like to add, sir?
Thank you. If all the comments are complete, I just wanted to do a brief summary on kind of the important parts that we've talked about internally over the past couple of weeks with Ron's team and Lake Health, and that is, and I know I'm beating the proverbial horse here, but we only have a limited number of doses and thousands of folks who deserve it without question. It is very important for folks to log on to the Health District's website, which will be published. It's in the release that went out this morning, so that Ron's team gets that pre-information, that when the time is right and the doses are available, that you will be notified to schedule, I can't stress enough, schedule an appointment. We have to have that. It's going to be critical. We've learned it from the fire chiefs. As we begin to scale up, the scheduling is going to be important. So,
And Jason, you made a really good point. I think maybe we should hit this just a little bit harder. The doses that go directly to the health district, we have 100% control over. Doses going to Lake Health, we're working closely with Lake Health, but they're coordinating that themselves. The doses that are going to the pharmacies and other private providers, such as individual doctors' offices, which it's not my understanding that any have been issued yet, but that is in the pipeline. That is outside of our control, but we can help, and I believe we're going to be putting out there who those potential private providers
yes,
are.
in the press release that the Health District, EMA, Lake Health put out this morning, those private providers are listed. And I know the Health District team has reached out to those folks to see where they are, but we did want to provide the information to them. And I'll let Ron speak to the 100 doses of his versus 300 for Lake Health and the collaborative effort that's going on now.
Yeah, so we received 100 doses of Pfizer vaccine for next week. Typically, we have been getting Moderna vaccine on the doses of 500, delivery of 400, and 400, and another 400. So that really left us way behind in planning. So working with administration and Dino DeSanto, we put that vaccine together. We've been in communications with the Federally Qualified Health Center, Signature Health under Jonathan Lee. We have 2,100 teachers that want to take this vaccine that we need to do in the month of February. And we'll be reaching out to the pharmacies that may not have a plan to help them administer that vaccine as well.
And if I could, as long as we've been giving praise and credit where credit's due, Lake Health has been a tremendous partner in this. They've helped us with our communications with the Cleveland Clinic and with university hospitals. Dino DeSanto has taken up the point of contact role extremely well and has taken our calls day and night, 24/7. Any information that we need, it gets pushed to us. Any information that we need and ask about, it gets responded to. So again, there is a tremendous cooperative effort taking place, and we keep looking for continuous improvement. So is it perfect? No, but we continue to take corrective actions and improvements at every opportunity, at every level.
That's correct. And to summarize, the 400 that will be available at some point next week are those that, the Health District, through the registration process, reverse 9-1, then ultimately the scheduling software, which will have a link that will be put forth. Those 400 are what we're talking about today. Ron's shop does not have jurisdiction over those that are going to the private pharmacies. So that's what we're dealing with. So patience, perseverance, Commissioner Hammercheck, you use those words all the time, I think are key. and we'll get through this. You know, I don't know if it was Joe Busher or somebody said in April we could see the light, but it was the train coming at us.
Yeah.
And I think today we see the light at the end of that tunnel. We've made the turn, I think. We're rounding second, hopefully. So happy to field calls from our residents, and we'll give you the information as best we get it, learning from Ron and Joe and the mayors. Often they're getting the information at the 9th inning for something that we need to turn around within 24 hours. So, you know, it's a very rapid turnaround. As I've told some folks who've called me, is if you feel as if I'm not answering your questions, maybe I don't have the information yet, but as soon as we get it and we synthesize it and we apply it to our models, we will certainly do that.
Yeah, and certainly please check the Lake County website for all the information, and it'll either be from CDC, Centers for Disease Control, Ohio Department of Health, or us locally. Please don't go to other sites that aren't approved or certified by us to get back to the right information.
And the press release was issued this morning at 10:15 a.m. This video on YouTube will be published to our mayors and managers group so they can in turn push that information out to all their users via various platforms as well. So I want to thank these gentlemen for coming in this morning and thank the commissioners for hosting. Thank you.
Indeed. Time, patience, perseverance. Thank you, Jason. Commissioner Young, anything more you care to answer?
No, I think it's well covered. Thank you, gentlemen.
Thank you for the opportunity. and
Any
the
of those in
support.
attendance? Ron, got anything else you'd like to add, sir?
No, yeah, just protect your family, hang in there, keep using social distancing, masking, and we'll get through this together by summer.
Excellent. Thank you. We will be continuing these updates on a regular basis, and anything that changes that's an immediate, we will get that out as well. And with that, do we have a motion to adjourn our meeting?
So moved.
Second, and discussion. None being heard. Madam Clerk, roll call, please.
Commissioner Young,
Yes.
Commissioner Hammercheck.
Yes. Thank you. This meeting stands adjourned.